This video provides a short introduction to fetal alcohol spectrum disorder and guidelines to support students who either have a FASD diagnosis or exhibit symptoms similar to FASD. The dangers of drinking during pregnancy have been documented for many years. However, our understanding of FASD, particularly what it means from an educational standpoint, hasn't really evolved. It is estimated that globally around 119,000 babies will be born with FASD each year. So it is important for education staff to recognise the genuine struggles of students with FASD and know how to respond to them. Students with FASD are often described as flighty, distracted, or overactive in the classroom. And as a teacher or support staff member, it is easy to become frustrated when we see a student who doesn't seem to be engaging with the lesson. But it is important to remember that for people with FASD, this behaviour is not a choice. The way that alcohol exposure affects the developing brain means that many with FASD struggle with something called executive functioning. This is the part of the brain that assists us with things like time management, organisation, forward planning, and control over our emotions and impulses. So people with FASD can struggle to pay attention in the classroom or follow complex directions. They may have difficulty changing from one task to another and have a lot of anxiety when dealing with change. Due to issues with working memory, it can be very difficult for people with FASD to complete more than one step at a time and to remember all the information they are taught during a class. Furthermore, because of their anxiety and difficulty recognizing and explaining their own thoughts and emotions, it can be very difficult for a student with FASD to know how to ask for help, even when they know they are struggling. So how can we support students with FASD or who are at risk of FASD in the classroom? Here are a few guidelines. It is important to remember that each student is different, and what works for one might not work for another. It is important to respect individual differences and play to the student's strengths to reinforce that they are capable and have strengths and talents that will see them through. First, we need to recognize that people with FASD process information differently to those who don't have FASD, so they are more vulnerable to distractions in the classroom. See, for you, bright fluorescent lighting and the sound of a ticking clock in the room, plus the sound of several students talking as they work together in a group, might not be distracting at all. But if we imagine the mind like a freeway, then for a person with FASD, each of these things is like another car backed up at the traffic lights, blocking the information from getting through. We need to find a way to communicate the lesson or information in a way that will make it easy for the person with FASD to process. This means minimizing as many distractions as possible. Using calm colors on the walls in a classroom may be helpful, as well as reducing the brightness of the lighting in the room. Since students with FASD can be very sensitive to noise, allow them to use earplugs or noise-cancelling headphones if they find this helps them concentrate. Provide an area in the classroom or nearby that is quiet and uncluttered, where children can go if they begin to feel overwhelmed, such as an interreception room if your school currently has one. If your student struggles with restlessness or excess energy, try using sensory aids such as fidget tools or an exercise ball that they can sit on and bounce or rock while they are listening to the teacher. They may also require regular scheduled breaks. Remember, these things are not to be seen as treats or incentives for doing the work, but rather as tools that enable students to participate in education as a human right. Teach routines and organisation skills. Sometimes visual cues are useful for this. For example, photographs could be used to show students where certain items in the classroom belong. Things should always be stored in the same place so that students are not distracted by looking for the items they need. Organise their immediate surroundings so that they can focus on the task at hand instead of trying to locate the materials they may need. Have them keep all of their pens and pencils in a box in their desk or in a pouch in their binder. This will help to reduce the time it takes to become focused on the task. Where possible, use the same staff members consistently, and if a substitute teacher or support staff member is required, prepare the young person in advance. Because students with FASD may struggle to retain information, clear, concise communication in the classroom is vital. Use brief sentences and provide one instruction at a time. Consider asking questions that could indicate the student's level of understanding of what they have been instructed to do. Simple repetition of instruction does not necessarily indicate understanding. It could be helpful to write down each step so that the student can cross them off as they complete them. Or, if visual or auditory clues are better for the student, try video or voice recording the instructions. Apps like Explain Everything allow you to record a video of the task being completed and provide a voiceover with instructions. This method is also good because it allows the student to access the information as many times as they need, independently. Lastly, recognize and appreciate every effort that the student is making. Most students want to learn, but are incredibly frustrated by the challenges they face. Progress is progress, no matter how small, and feeling appreciated could spur your student on to continue achieving. For more information, contact Disability Policy and Programs in the Department for Education.